BestYears, a monthly show for those over 50 and all who will be someday. Here's your host, Gene Pritz.
Most of us seek the help of a medical doctor when we're faced with sickness and disease. However, what would you think if I told you that many of the diseases that afflict us are preventable, or that prescription drugs are not the only course of treatment for many of our ills? Our topic today is alternative medicine, a term that refers to a course of treatment that is not part of the medical mainstream. Treatments like acupuncture, homeopathy, vitamin and herbal therapy, massage, meditation, chiropractic, biofeedback, and hypnosis all fall under the alternative medicine category. But before we start, I want to say that we at the Best Years are not advocating one course of treatment over another. We simply want to offer you some insight into treatments that may benefit your overall health. My first guest is Alison Gilbert, the president of Alison's Healthcare Resources, a company dedicated to holistic health and elder care. Welcome, Alison.
Hi, Gene.
Tell me about alternative medicine.
The first thing I'd like to tell you is that it's a lot easier to do than it is to pronounce.
Okay.
Alternative medicine is an area that I've been involved in probably for about the last 20 to 25 years personally. And I have found that it involves a system of medicine that is very different, although very complementary to mainstream medicine. It involves techniques that have many traditions from other cultures, very long and respected histories. Primarily, the use is for the restoration and the maintenance of wellness.
Tell me about some of them. I mentioned homeopathy, and I hope I'm pronouncing
Homeopathy.
it. Homeopathy.
Yes. Homeopathy is a system which happens to be very well respected in England. The Queen of England has a homeopathic physician. There are homeopathic hospitals throughout.
Just what is it?
Homeopathy is a system of medicine which uses the theory of like treats like. And what you do is take an infinitesimal dose of something to actually treat the problem. Vaccines, I think, are based on a similar idea. Usually the medicines come in very tiny pills that look like sugar pills and are put under the tongue and allowed to melt. They're also very inexpensive and, in my experience, have worked very, very well.
Biofeedback.
Biofeedback, essentially, is the Western equivalent of meditation. What's found...
Say that again?
It's the Western equivalent, or what it does is make meditation palatable to the Western consumer. Basically, what biofeedback does is help to train the individual to reach certain brain wave, or to establish brain wave frequencies within their system, which bring about relaxation, which can then lead to stress reduction and all kinds of other wonderful benefits. And essentially, it has a very similar effect to meditation, but it works with machinery and in a way that Westerners often are more comfortable.
What about some of the others?
Massage, which is a favorite of mine.
And that's considered an alternative medicine?
We've had discussions previously, myself and my colleagues, as to exactly what alternative medicine is. There's one thing that I would like to mention which I think qualifies it. Alternative medicine tends to be low technology, it tends to be non-invasive, and it also tends to be very cost-effective. In terms of a technical definition, sometimes what qualifies alternative medicine is what the insurance companies don't cover. I hope this is not going to be a permanent definition.
Of these things, do you think any one is better than the other, or does it depend on the individual?
I think it very much depends upon the individual, because most of the techniques are really developed to help bring about balance and establish wellness in the individual. And many of the techniques that are being used are from different cultures and were really established through their traditions.
You know, when you say different cultures, the first thing that comes to my mind is what I call herbal medicine.
Herbal medicine,
Herbal
yes.
medicine.
Well, herbal
This is a whole new language for me.
Yes, it is. Well, that's why I say pronouncing it is the hardest part. It's really, I found, a very pleasant way to restore wellness, which actually is another way of calling, overcoming disease and maintaining wellness, which we mostly understand as prevention. Now, I've been practicing many techniques for many years, and I am very youthful and very healthy for my age.
This reminds me, our grandparents way back used a lot of these things.
Yes, they did.
And is it coming back in style, if that's the right...
Yes, I definitely think that there's sort of a renaissance of alternative healing, and it's for a number of reasons. I think that on occasion, mainstream medicine, people are finding some displeasure, and it's also become extremely expensive.
We started to talk about herbal medicine.
Yes.
And as I said before, that reminds me of the Indians with herbs and things like that. Is that what it is today?
Absolutely. There are many cultures that have herbal medicine. There's Ayurvedic medicine, which is Indian. There's Chinese medicine, which of course comes from China. They're very big on herbal medicine. And there are herbs that are native to this country, which again is a part of the tradition of Native American healing. And yes, these are things that people actually grew in their own yards. And there was not the accessibility to medical doctors the way there is today, but the cost is also becoming somewhat prohibitive. And I think people want to put their own care more in their own control.
Let me go to a different tack. How are we going wrong? How are seniors in particular going wrong in taking care of their health?
Well,
or are they?
I very much think so, and I think the current healthcare crisis is proof of that. And I think the senior population in particular is also proof of it, because what we really have learned to do in this very wealthy country is really kind of take our bodies for granted as we have the natural resources. And unfortunately, what happens when someone reaches certainly their 50s, 60s, and 70s, which is the focus of your show, if not earlier, they find that they've abused their body. Now, Western medicine categorically has a tradition of replacing parts wherever possible and doing very invasive techniques. Well, the message really is to not wait until that happens wherever possible, and whenever possible to pick the most balancing, least invasive way of going about restoring and maintaining one's wellness.
Well, it's very interesting, and to me a whole new field. It's interesting that you mentioned about the seniors and how they should be handling themselves.
Well, there are a lot of things that people can do at all ages. Now, I'm almost in the category of your program. I'm 45 years old, and I know I look very young. Things like exercise, good nutrition, and all kinds of things which I know your other guests will be discussing.
Right.
There are lots of things people can do at all ages to stay and get well.
Well, thank you, Alison. It's been very informative. We have to take a short break. We'll be right back with the best years.